Hello, class. My name is Yasmin Ruiz, and today I decided to give my presentation on colon cancer. I find this topic very interesting since I am aiming to get my master degree in nutrition. It really falls back to why we should take care of ourselves to avoid this cancer because it can be prevented and we can avoid it. We don't have to go through this. The stages of colon cancer, we have four different stages. As we can see, if we get to a level where it escalates, it can cause to spread to other organs. Also, again, what exactly is colon cancer? So colon cancer is a tumor that starts to develop in your colon or large intestine. Our large intestine is a long tube near our digestive system. As you can see, the colon roll is responsible for removing fluid and some nutrient from the food you eat. Colon will then push the solid waste and expels it from the body through the rectum. We also have the polyps. Most colon cancers begin as benign polyps, which notifies they are non-cancerous. Also, polyps growth are most common in colon, and because they are abnormal self growth, it can eventually become malignant. This really, I recall a lot when Mr. Benavides was actually mentioning the word malignant, and the word itself says it all, malignant. So that's when it escalates and it really gets out of control where it's harder to cure it because it has spread into your body. Now, the colon cancer is preventable, it's treatable, and it's beatable. We also have the risk factors. It has to do with your diet, processed meat and red meats, physical inactivity, obesity falls back into your eating habits. This is why we should really implement having good eating habits. We also can provoke it by smoking tobacco, heavy alcohol use. Certain ages have a higher peak of when you can be diagnosed with this cancer. We also have the racial and ethnic background, and type 2 diabetes. As I was saying, the highest peak of people who are in higher risk of being diagnosed with the colon cancer is at 50 and older, but it can also begin from the age of 25 and above. As you get older, chances increase a lot more. Here is the screen testing methods of the colon cancer. We do have one that is called the colonoscopy. I don't know if I pronounced that right, but I hope I did. But what is this screening testing is you are giving instructions before you go in to get this colon test. And it is basically that you have to have your colon cleansed so the doctors can get a camera tube into the rectum to be able to see through the colon to make sure that you don't have any tumors that are growing there that shouldn't be. So it is a very uncomfortable situation, which is why we should consider taking into consideration what we feed our bodies to really avoid all of this. We also have another method of the CT scan, which is used when you go into like this huge tunnel. And yes, it's the CT scan, computed tomography. What this does is it really goes in and it sees if there's any abnormal tumors growing. And if there is, you can see them, and it really gives you that clear image and confirmation that you have it or you don't, if it comes out positive or negative. Here is the normal colon tissue. As you see, the cells are very nice shaped ovals. They're organized and they're lined up. As you go to the cancerous colon tissue, we see our cells stacked up, very disorganized, and very abnormal shapes. Here are our treatments, side effects, and complications. Side effects, we do have the feeling of fatigue, sleep difficulty, anxiety, depression. And as for complications, may include infections, blood clots, damage to nearby organs, or leaking between the removed parts of the bowl. Now, new discoveries is on August 2019, according to food scientists, frying oil to mice exaggerated colonic inflammation. It enhanced the tumor growth and worsened the gut leakage, spreading bacteria or toxic bacterial products into the bloodstream. I found this very interesting, guys, because this is the intestines of the mice. And as you can see, with that horrible frying oil or any food that is processed, it just caused this intestine to clog up with tumors. And this is exactly what happens to ours. And I really enjoyed educating myself on this as well. I hope you guys enjoyed it and get something from it. And yes, you guys have a good night or a good morning. And I hope you enjoyed.